to introduce the County Supervisor Ken Yeager to the podium. Let's give him a big clap.
Well, thank you. It's great to be here, and my main role for this evening is to begin the introductions on how we're going to present the county budget. But I just wanted to say that it's been my pleasure to oversee District 2 since there was the vacancy in that office, and I think all of you know that the office continues to run very smoothly. I know you all introduced yourself, but Megan is the interim chief of staff there. She has been my chief policy aide for 10 years and is doing a great job, and Andres and other people in the office continue to do all of the constituent work that needs to be done. And it's great that Supervisor Cortese is here this evening as well. Again, I think all of us have been looking over all of the issues dealing with District 2, making sure that you're getting very good representation on the Board of Supervisors, and that your concerns and your issues are being heard, particularly during the time as we approach the budget hearings. And in just a second, Barry Stevens, who's our budget director, will give you an overview of the issues, and we are all here to answer any questions, along with Jeff Smith, who is our chief executive officer, and we will be here throughout the budget presentation. But if you need to get a hold of us afterwards, you can talk to Megan or talk to Andres, and we'd be happy to answer any of the questions. It's always good to be back here. Supervisor Cortese and I were both on the City Council in 2005 when this wonderful, wonderful library was dedicated, and we just think it's just been a tremendous resource, obviously, for the whole community as we've gotten these new libraries throughout San Jose. Like many of you, I was very involved in neighborhood issues before I was elected to the City Council, president of my neighborhood association and president of our library association as well. So I know that District 5 United is just doing a lot of grassroots activities. It's very important to have that link between the elected officials and community members, and your organization just does a great job at that. So I was very happy that we were invited to be part of this presentation this evening. So with that, I'm going to introduce Mary Stevens, who will give, I think, about a 20-minute presentation, overview about the county budget, and then afterwards we can answer any questions that people have. Mary?
Thank you very much for having me here tonight. Ken thinks I can talk longer than I really can about the budget, so my presentation will probably be closer to 10 minutes, hoping that I can give you about 10 minutes of questions and answers. But I just like to remind people sort of the context of our county budget, just to put to everything in scale. Our total budget's about a $4 billion budget. The part of our budget that you hear the most about is our general fund, which is about half of our budget. It's about $2 billion, and it's more of the discretionary part of our budget. We have non-discretionary funds, our roads department, our parks department, those sorts of things, which are categorical funds. So either by legislation or by voter adoption, certain revenues go to these departments and can only be spent on those things. So I can't spend roads money on correctional officers. I can't spend parks money on accountants in my finance agency. So we keep those separate. The general fund is where you hear about our troubles over the years in terms of deficits and needs to cut, because we're primarily funded in the general fund by three sources: state revenue, federal revenue, and property taxes. Those are the big things, and we're not in control of hardly any of those. We're at the whim of federal and state budget decisions, and property taxes rise and fall with the economy. We're fortunate that right now we appear to be coming out of this recession, and economic indicators are going up, and that gives us a little more revenue. But in the current budget that we're presenting to the board for the June budget hearing, we have a $67 million deficit in our general fund, meaning that our expenditures, our planned expenditures, will exceed our revenues by $67 million. unless we close the gap. So the recommendations we're providing to the board are how to close the gap between our revenues and expenditures. We are doing that in a variety of ways. The first way is that we have asked our departments to basically run a tighter ship, be more effective, be more efficient. And that accounts for about 28 million of our deficit solutions, more or less. And I'll talk a little bit more about some of those reductions in a moment. Another component is the use of $20 million of Measure A funds. Another thing I'll get into a little more detail, but that $20 million to preserve our existing service levels, basically to make sure that we don't have to cut any deeper than the 28 million that we're already cutting in the department. And then the third component that makes up the rest is looking to our employee groups, to our labor groups, to make some labor concessions in order to help us reduce the cost of providing a unit of service by looking at how to fund salaries and benefits differently. So that's sort of the grand picture. We want to talk about some of the reductions and how the departments are reducing services or how we're funding those services differently in order to be more cost effective. I think it's important for everybody to understand a few different strategies that we're using. One of them is in the social services area. We're looking at actually increasing our revenue assumptions based on some of the state budget projections. It's a little bit unusual for us. Generally, we wait until the state budget is passed so that we're sure what the state budget impacts are going to be, and then we address those with our board. But because the economy is improving, and because the state budget, both the January budget prescribed given to us by the governor, and the May revise, both show us that the state is planning on allocating to counties increased monies in the social services area. We really want to recommend to the board that they book those revenues and count those as a solution to close our gap between revenues and expenditures, rather than cutting services and programs, wait for the state to pass their budget, and then restore those services and programs. It just feels too disruptive to both our workforce, to the community who receives our services. So we're counting on some revenues, crossing our fingers that those stay in the budget solution at the state level. Another area that is really helping us is the public safety realignment revenue, what is commonly referred to as AB 109. This program is now contributing $40 million in funding to the county. That money comes with some strings attached. We have to provide certain services related to the new population of people who come to us through the AB 109 structure. To remind people that when this legislation was passed, what it meant was that certain people who had committed crimes in the county that might have otherwise been sentenced to state prison are now being sentenced to serve their time in the county, which means we have a growing population of inmates. Also, inmates who are being released from state prison who, before this legislation, would have been watched by state parole officers are now being assigned to the county to be watched by county probation officers. So that's where the money was given to counties in order to help us meet these new mandates. And in Santa Clara County, we're proud that we believe we're sort of a role model for the state in terms of how to address this population and these issues. We try to be very balanced in our approach between both programs to these individuals to try and help them get out of the cycle of the criminal justice system and lead more productive lives, but also to allocate some of these monies to our law enforcement agencies, public safety agencies, to make sure that we're keeping the community safe while we're dealing with this enhanced population. That money has been helpful to us in closing our budget deficit, because what we have been able to do is relook at how all of our public safety resources are allocated, and to the extent that we can refocus and redesign these resources to fit within the definition of the new public safety realignment programs that we're offering or strategies that we're employing, then it is allowable for us to use some of that $40 million in order to offset the cost of those existing resources. So what we've basically done in several areas of the budget is take existing services, existing staff, existing programs that we're doing, looked at them in the context of AB 109, made the changes that we need to make to fit them into our grander plan, and it allows us to use that revenue as opposed to having to add new staff or cut existing staff and then, add different kinds of things. So that's been a great boon to us. It's allowed us to capitalize on our existing strategies, and again, avoid the disruption of cutting staff, cutting programs and services that are already in existence. Instead, we're retooling those to fit within our new program. So let me talk for a moment about the Measure A component of our solution, which is using $20 million of that revenue to preserve current services. The Measure A revenue comes from the voter-approved sales tax, 1/8 cent sales tax that went into effect on April 1st. Just as a side note, the county has not received any of that money yet, even though you've been dutifully paying that every time that you've paid your sales tax. This is because immediately after the election, we were involved in litigation with a group who wanted to say that the Measure A on the ballot was an illegal ballot action. We're fortunate that we prevailed in the litigation in our local court. They immediately appealed. And last week, 2 weeks ago, we were successful at the appellate level. We're waiting now to see whether or not this group wants to kick it up to the Supreme Court. They have, I think, 60 days to decide. Personally, I think it's doubtful. It's a lot of money for them to spend to kick it up, and it's doubtful that the Supreme Court will hear it if they do. But we have to wait for that sort of thing, and the state needs to wait for that. Once the litigation is completely solved, then the money that's being collected from sales tax, which is residing in a bank account up in Sacramento, will begin to flow to the county. So we're waiting for that money. When we get it, we believe this is going to translate into about $45 million a year for the county on an annual basis. And it was clear from the ballot measure that the voters approved that they wanted to preserve and enhance services in certain areas, our public safety and justice programs, our emergency department and trauma center, those sorts of programs. And so when we looked at this revenue coming into us and said, what is the best way to meet the needs and the will of the people who voted this tax on themselves, we looked at the deficit that we had and said it makes no sense to cut existing services in our public safety justice programs, in our emergency room and hospitals and clinics, and then use Measure A money to, add back programs or create new programs or whatever. Instead, we said there's a basic preservation of services that is necessary. We don't want to disrupt existing services that are being successful. So we used, from a balancing the books perspective, we're using $20 million of that revenue to preserve existing services at the hospital, clinics, public safety and justice, in our social services programs, those sorts of things. That leaves another $25 million that you say, well, what are you doing with that? Where's that money? We have recommendations to the board for about $15 million of the balance to fund specific proposals that we've received from county departments and from community stakeholder groups around enhancement of existing services and creation of new services. And then another $10 million that we've recommended to the board that they leave in a reserve for the moment to allow more time to both see how other state and federal decisions might impact us, whether or not we need that money to further preserve services, or whether additional ideas or strategies for improving services to our community come up during the process. The $15 million that we're making recommendations on to the board, you can see in more detail. I should have said this at the beginning, county budget available on our website. You go to the county's website, scc.gov, there's a button sort of in the middle of the screen called Hot Items. And you can, if you click on Hot Items, one of those items is the recommended budget. You can see the whole budget there. So, the Measure A $15 million that we're recommending be allocated is being recommended for such things as healthy kids, to increase the number of uninsured children that we can provide insurance for, make sure they're hooked up with an insurance plan. Permanent supportive housing for some of the chronically homeless, particularly those who are disabled, either physically or by some of the others.
Affordable housing.
That's it, the permanent supportive housing. There's, a restoration of some of our safety net contracts through social services. In prior years, we cut into some of our safety net contracts with our community-based partners, just as deficit solutions, and one of the uses of this money is to propose to restore some of the cuts that we made in prior years, to bring things back up to an even level. There is a couple different proposals from in our health area, one for a public health sort of expansion of public health efforts, we're calling it Epicenter, and it will allow for some broader-based community assessments and development of strategies to improve the health of the total community in Santa Clara County, as opposed to focused on a particular disease or a particular clinic in a region or something like that. This is meant to give us a broader sort of sense of what are the needs of the community countywide. So those are some of the things that we're recommending for the Metro aid monies. The budget that we presented to the board is a balanced budget. It does resolve that gap between expenditures and revenues, but we feel like there's still a lot of risks and threats to us out there. One of them is the assumption that our labor groups will, in fact, be able to negotiate with us the kind of savings that we need on an ongoing basis. This is our workforce, frankly, has been without any sort of raise for years and years now, and it's difficult when to look at the cost of providing services when it's mainly related to the cost of labor. So on the one hand, you're looking at how to squeeze that, and then you have to remind yourself that everybody on your workforce is a member of the community just like you, with a mortgage or rent to pay, with kids to feed, and with their own lives to lead. And so trying to achieve those balances is difficult at best. Of more concern to us even is the outside threats over which we have very little control, even in terms of negotiating. And those are things like the impacts of federal sequestration and the cuts at the federal level, and some of the state strategies. Dr. Smith is more familiar with some of these than I am, certainly, in terms of both policy and program, but at the federal level, we're very concerned about how some of the cuts to Medicaid funding, Medicare, and Medi-Cal are trickling down to the local level. When you say that, oh, don't worry, we're not really taking anything away from, any benefits away from the Medicare recipient, they'll still get all of their care. What we're doing is we're taking away reimbursement from the Medicare provider. Well, that harms the county in two ways. As a provider, we get less revenue from the federal government, but what it also means is that because all Medicare providers throughout the county will receive less reimbursement, fewer care providers want to participate in the Medicare program, and that will make it harder for the people in our communities to find Medicare services, whether they're provided by the county or by some other health provider. So those sorts of things cause us some concern. And from the state level, the governor's proposal for Medicaid expansion, which is a program that I'll probably have Jeff explain if people really want to know about it. It really tips the balance around how Medicaid, Medi-Cal services would be funded between the state and the counties. And without being too much of a cynic, having worked in the county budget arena for nearly 25 years now, I can't remember a time at which the state came up with an idea about how to shift responsibilities and or money from the state level to the county level, and the counties won. So we're watching this very carefully about how the funding may shift and what responsibilities will come to the county and what kind of funding comes with it or gets taken away from us to figure that out. But we're very concerned about whether or not the state's estimates of what kind of Medi-Cal reimbursement we might get under the current plan would actually come true, and who would be left holding the bag, so to speak. So that's an area in which we continue to have a lot of concern. So that's sort of the long and short of it in terms of some of the service areas that, you know, those of you in this room might be interested in, that the county provides, and you perhaps, you know, have some interest in watching. It might be of interest to note that we're working on a plan in our mental health and Department of Alcohol and Drug Services area to look at how to combine these two departments, which right now are two different departments, one treating drug and alcohol issues, one treating mental health, and yet many of their clients coexist. They're dual diagnosis clients. Often people develop drug or alcohol problems because they're trying to self-medicate over a mental health issue that they haven't had the correct access to care for, hasn't been correctly diagnosed. We're looking at how to combine those to make a more efficient and effective delivery for our clients. The budget that we've recommended does not make specific recommendations on, you know, steps for doing that, but it initiates sort of that planning process. And so that's something that will be happening during the fiscal year as we work with all the community stakeholders and our community partners on how to do, how to make progress in that area. In the public safety justice area, I know that in this area there's a lot of county pockets, so you have some, you know, city police, county sheriff, where we're going. One of the things that we're concerned about is the vacancy rate we have for our sheriff's department. We have a lot of vacant positions. They're funded. It's not a budget problem from a funding perspective. It's about getting bodies into those codes. And so one of the things that we've done in this recommended budget is fund a new sheriff's academy so that we can get more people trained and hopefully recruited and hired and, you know, boost those ranks of officers that are on the street to help with the public safety element. So those are a couple areas that I thought I'd mention. I don't know if you have specific questions about specific service areas, but I'm glad to take those and see if I can address them. Sure.
What impact will the Affordable Care federal program coming down have on California programs as well as the county programs?
That's a good question. Jeff can offer a lot more detail than I can, but I think one of the
Can you
things
repeat the
is
question?
that it's going to shift us from being the provider of last resort. Primarily, you look at something like Valley Medical Center, and people see it as a picture of, you know, if you don't have any place else to go, you can go to VMC. Because of the way funding is changing, that's going to shift to we need to be in a position to compete with other healthcare providers and make ourselves a provider of choice, not a provider of last resort. And that's a big challenge for us. I'm going to let Jeff talk a little more about the Affordable Care Act, though, because he's our expert on that.
Can you hear me? Or should I use the mic?
The mic, please.
Do you want me to use the mic? Okay. The Affordable Care Act, the whole concept behind it was to try to save money by pushing the risk for health care down to the local level. And in California, the local level is the county health system. And so what we see coming is a lot of risk for health care, but a lot of opportunity at the same time. So exactly how it's going to be played out still remains to be seen. As Mary mentioned, the state is working on what they are calling Medi-Cal expansion, which is part of the ACA program, to try to get more insurance to people who are making income over the current Medi-Cal rates, but below a place where they can actually afford insurance. There's also the creation of the exchange, which is then another step up in income where people, you know, can afford to buy insurance, but they need to have an insurance product that's affordable. All these things are moving at the same time. The state's talking about trying to fund their risk by pushing more programs down to the county, mostly in social services. So that's one of the reasons why this year's budget we really characterize as a bridge to uncertainty, because we have so many different moving parts. It's going to be very difficult for us in the next year and a half, 2 years, to be absolutely sure what's going to happen with 6 months. So we're recommending some reserves, recommending efficiencies. We've done a large investment in the hospital health system to try to make it more efficient by putting in an electronic medical record. We're trying to make it more efficient in a lot of other ways. We're trying to get the services out to the community, keep people out of the hospital, in the community, in the clinics. But the basic answer to your question is nobody knows. That was a long answer for nobody knows. Yes, well, there was a question here first.
So one of the questions I had was related to the ACA, but I think we touched on all of that. The other one was about, I remember coming to a meeting a few years ago at the county where we were told that a large percentage of the crimes against children were not being investigated because of budgetary situations. And has that picture changed at all, or is the uncertainty from all these other moving parts preventing us from being able to move around on that?
You must have been at that meeting quite some time, but because we've been committing all the budgetary resources that we can to work with crimes against children in multiple areas, in our health system, in our DA's office, in public defender's office. So we're not holding back any money when it makes a difference to kids, or for that matter, domestic violence. That's one of the other things which is in the Measure A funding is a large contribution for domestic violence. Prevention of domestic violence. Yes?
So I keep hearing from neighbors and other community members that this whole reentry is the reason why we have such a huge spike in crime. And I don't know if you guys have any words of wisdom there of how we can, I don't know if that's true or not. But that's the buzz that I hear out there.
Yeah, that's not true at all. As a matter of fact, we've been keeping very close watch on all of the new parolees, what used to be parolees that are coming back to our community. And our rate of re-offense is extremely low compared to what it had been in the past with state parole watching after these individuals. So remember, there's no new individuals coming back to our community. These are all individuals that would normally be put on state parole. And what we've done at the local level is we've created an entirely integrated system of services with a reentry location at the county center where they can get all kinds of services that address social needs, mental health needs, medical needs, housing needs, and training needs, education. And so we found that we've been really able to integrate them back in the community. Our recidivism rate for the last year was really only in the range of about 19%, whereas if you look at what it was for state parole before AB 109, it was more in the 60% range. And if you look at the crimes that are being committed, they're not being committed by AB 109 parolees. They're actually being committed by individuals who are already in the community. And we've got stats to prove that.
One other question has to do with homelessness. I see a lot more homelessness, it seems like, and I don't know if it's because I'm more aware of it, but it's normally around the creeks area, and they seem to be kicked out of a certain area, and you'll see a whole new encampment somewhere else. I didn't hear anybody's going towards that, or what's the county plans on that?
Actually, we are putting a lot of money into homelessness. You're right, it has been on the increase during the economic downturn. People losing their jobs, losing their homes, lots of people, with foreclosures, lots of need out there. The Measure A money, as we mentioned, we are putting a large amount of money. I think it's $4 million into creating affordable housing for the homeless. We've also already been working closely with a number of the community-based organizations and cities on a program called Destination Home, which has been going on for a number of years, which is designed to provide services to keep people out of homelessness. So there's a different style of service compared to how long you've been in homelessness. If you've been chronically homeless, you need really wraparound services with a complex system of services to really get you back on your feet. If it's temporary homelessness, we can use other models to deal with that. Voucher system, which was created in the county, separate from the Housing Authority voucher system, and a number of temporary housing programs that we funded. We are concerned, having said all that, and knowing that we're very concerned about it, the city of San Jose is extremely concerned about it. We are concerned that the sequestration that's going on in Washington, D.C. right now, one of its major effects is to eliminate funding for HUD, which is the Housing Department, which means a huge cut in our local funding for Housing Authority, the Housing Authority, in this case, Santa Clara Housing Authority. $16 million cut basically overnight. That's going to have a huge impact on the services that they provide. So we're looking, the board is looking into ways to try to substitute for those services, and the board has made the commitment that a significant portion of any monies that we realize, new monies that we realize from the dissolution and redevelopment will be put back into housing by the county. The county will be partnering with cities in order to do that. So it is something we're really conscious of. The board's always reminding me, do more, and we're trying everything we can think of.
So let's give Mary a